July 17th, 2014, at 7:32 p.m., we were blessed with a beautiful baby girl. We named her Ellie. All seemed routine until 12 hours later when both Ellie and I suddenly became critically ill. We were airlifted to Calgary and spent the next 18 days between the Foothills Hospital and the Medicine Hat Regional Hospital. Eventually, we were discharged with a clean bill of health and returned home to begin our life as a family of 5. Then one February day in 2017, we noticed concerning behaviors and physical symptoms in Ellie, which prompted us to seek care from our pediatrician, who quickly referred us to the Alberta Children's Hospital. Walking through the hospital doors again for the first time after the traumatizing events of her birth made my heart race and my hands tremble. Ellie suffered from what was thought to be a rare disorder and began being followed by a number of specialists. Over the next 3.5 years, traveling for care and diagnostic testing became a way of life. Our family was forced to revolve around appointments and trips to Calgary. Trying to maintain a sense of normalcy for our 2 older children, juggling mine and my husband's careers, all while adjusting to our new normal for Ellie's care was overwhelming. Almost daily, I felt enormous levels of anxiety, guilt, and stress. Ellie's care became a full-time job. In addition to managing her at-home care, I had to coordinate specialist consults or diagnostic testing to avoid multiple road trips every month. Still, Ellie and I would often travel 6 hours in one day, sometimes in dangerous conditions, for a short 30-minute appointment. Ellie suffers from severe medical trauma, and I would often leave those appointments with no new answers or direction, thinking, there has to be a better way. There is no reason Ellie should have to go through all of this. And then came COVID-19. I had no idea how we were going to manage all of these appointments in a pandemic, and was shocked when I found out that for the first time, we would have a phone consultation with our new endocrinologist. I remember sitting down at my kitchen table, phone in hand, while Ellie and the boys quietly watched a movie in the other room. There was no crying, screaming, or consoling. Almost no anxiety at all. We spoke for over an hour, and when the appointment was through, we had a plan, and for the first time in a long time, I felt like I could breathe. As I told my husband about the call later that day, I began to cry. Not tears of frustration, but tears of relief. After 4 long years, I had a sense of control over how Ellie was receiving care. As parents of a medically complex child, we fully understand what warrants a face-to-face appointment. It has been amazing to be able to now schedule a follow-up call during my lunch break at work. Pre-COVID, the option for virtual appointments was not considered, even when we requested. It is clear now that the system had the capability, but not the will. Patients deserve a seat at the table in the design and delivery of healthcare, and now we know that can happen at their own kitchen table.